Hello everyone, welcome to Dr. Spine. So today we will be discussing about Marfan syndrome. So as you can see on the screen that Marfan syndrome is an autosomal dominant disorder which is caused due to mutation in the FBN gene on the chromosome number 15 and that encodes a protein known as fibrillin 1. So as you can see that normally fibrillin helps as it is an extracellular glycoprotein that serves as a structural component and provide an elastic and non-elastic connective tissue. In an normally fibrillin sorry normally fibrillin acts as a structure support for connective tissue, elastic or non-elastic. Here there is mutation in the FBN gene, so whatever the fibrillin is produced, it is in mutant form. There are two pathogenesis. Fibrillin, which is mutantly formed, it doesn't act as normally and it causes abnormal connective tissue. Plus this fibrillin prevent normal function of the fibrillin which was normal from the other. As you can see, there is maternal and paternal chromosome. If the paternal chromosome is abnormally producing that gene, so that fibrillin would also prevent normal function of the gene coming from maternal. It also prevents its normal function. So due to that mutation in the FBN1 gene, there is abnormal fibrillin 1. Thus the structure support of the connective tissue is abnormal. This results in mainly three complications. As you can see here, is fibrillin causes three complications in the eyes, cardiovascular system and skeletal system. As you can see on the screen that in skeletal system, from going from top to bottom, you can see that there is high arch palate. Along with that, on the chest you can see there is deformity. There can be pectus excavatum, as you can see here, or can be pigeon chest. Then going further to the hands, you can see there is long fingers, abnormal extremities are seen. You can see the legs are longer than normal, and on the spine you can see that there is kyphosis or scoliosis. So I have written all of the things below, that the person is tall and slender build. As you can see, there is disproportionately long arm, legs and fingers. There is high arch palate here. Along with that, chest cavity can be protrudes, which can look like pigeon chest, or dips inward, pectus excavatum. Abnormally curved spine and flat feet. In the eyes, there can be, as we know that connective tissue is present throughout the body, so there is deformity in that also, as the lens is the position of the lens, there can be lens dislocation caused ectopia lentis. In the lens dislocation, lens from its normal position here goes to this new position. The movement of the lens is upward. Also there can be retinal detachment. As you can see here, from here the structure of the retina has been detached, and also can be retinal tear. These are there is retinal tear. Also there can be early onset of glaucoma. In the cardiovascular, there can be aortic aneurysm, aortic dissection or valve malformation. As you can see on the right side, that I have drawn heart, and due to the loose or abnormal elastic tissue fibers or connective tissue, the aorta is enlarged. Aneurysm of aorta that can be repaired by graft. As you can see, aortic graft is a surgical repair. There can be dissection of the aorta. When healthy vessel blood the jet of the blood pass straight, but sometimes due to this abnormality there can be rupture of intima, resulting in dissection of media. Diagnosis of Marfan syndrome can be done by finding through, if heart test, we can see echocardiogram or CT or MRI. Echocardiogram is the best for it. Eye test, finding through slit lamp exam or eye pressure test if glaucoma there, if we have any symptoms related to glaucoma, or we can do genetic testing. Now what can be done for treatment? We can give BP lowering drug to prevent further damage to the aorta or enlarging aorta, like BP lowering drugs prevent the high blood pressure, reduce, thus the aorta wouldn't have to go through shear stress. Also that reduces the risk of dissection. There can be vision is often corrected by glasses, and surgical process can be done by aortic repair, scoliosis, breastbone correction, or eye surgeries. Thank you. That's all for today, guys, and don't forget to like and subscribe.